Hello, my name is Carly Ziegler. A lot of you probably recognize my voice, but not my face. I am a licensed health insurance agent with RV Insurance Benefits, and today I am going to show you how to use a PPO network search. So first off, I'm going to go ahead and share my screen with you, and then I'm going to turn my video off so that my screen over here has a little bit more bandwidth and isn't all jumpy. There we go. So the network search that we're going to be looking at is the First Health Network, and that is the PPO network for Philadelphia Americans health insurance plans. So the Health Saver Plus Gold plan, the Premier Health Saver plan, Health Choice Select. If you have one of those plans, this is going to be a great video to show you how to find an in-network doctor. So first, we're going to go to neweralife.com. New Era owns Philadelphia American. This is the website where you get to everything that you need online. This is how you log into your policyholder portal. This is also how you search the PPO network. So we're just going to scroll down to policyholders, provider search. You can also search up here in the top right-hand corner. Both buttons take you to the same place. If you do it this way, we're just going to search for hospital indemnity plans. Here is our First Health PPO Network. To search for a provider, what we're going to do is we're just going to click Start Now, and we're going to select our provider type. I usually look for a provider that's accepting new patients, but you don't have to. You're going to enter in whatever zip code in the United States you are in. So I'm just going to use my zip code here in North Carolina, and then we're going to search within 10 miles. This is going to pull up like a million doctors if you are in a relatively populated area. So what I typically do is after I do that initial search, you'll see I have 826 matches. I'm going to refine my results. So let's say, for instance, that I was looking for a dermatologist. What I would do is I would go into specialty, and you can either scroll down on the list or you can start typing and it'll pull up what you're looking for. So dermatologist, maybe I want a provider that's accepting new patients. If I have a specific physician or practice that I'm trying to check to see if it's in network, I could enter that here. It's imperative that you spell your physician's name properly and last name, comma, first name if you're looking up a physician in here, because if you spell it incorrectly, it will not come up. So then we're going to click this green refine search button, and it's going to pull up dermatologists in my area. Here we go, 17 results. That's much more manageable. This is actually my dermatologist that I use. I haven't used him in a really long time, but it turns out that he is in network with the insurance. So when I get to this point, if I was looking for a new doctor or a new dermatologist, what I would do is typically, instead of just starting to call the phone numbers, I refer to Google. So I would do like dermatologist near me. And what that's going to do is it's going to pull up all of the dermatologists near my location. And then what I can do, this is my dermatologist, so I'm just going to use it as an example, is I would go to that website, and pretty much every network provider's website is going to have information on what the doctor's names are. So here, usually it'll say providers or something like that. Meet the team. Here we go. I'm going to click on that. And here is my dermatologist. Here is his name. Then I can refer back to the network search. And there we go. He's in network. So that's how I typically find doctors, because I'm big on reviews. I like to see that they got 4.9 stars. This is obviously a good place to go. It's going to give me quality care versus instead of just calling down the network search team. You can do it that way, but it just seems like you're leaving a little bit more up to fate if you just start calling these phone numbers. So that's how I typically find a in-network physician. I'm going to go ahead and let's go do a new search. Let's see if I can search for my primary care physician who I know is in network. Primary care physicians. See if they have primary care even written as a specialty. Nope. So I would click that button and then let's go refine search. 241 matches. So we got a lot of primary care physicians here. Let's refine our results even more, and I'm going to enter in my doctor's name and see if he comes up. So this is my primary care doctor. I know that they're a network because I've used them before and they've filed claims for me. They have an insurance info tab, and First Health comes up as one of their in-network insurance carriers. So that's how I initially figured out that they were in network with the First Health Network. Then let's go to providers. Okay, this is my doctor. And then this is the practice owner. Let's just look up Michael Hardy first. So we're going to do there. See, look, see how it dropped down like that? Let's see if he's in network. There he is. Then maybe let's search for the practice, Hardy Family Medicine. Let's see if we can get that. So let's take him out. See if we get anything there. These searches are finicky. See how it pulled up another, that's interesting that it pulled him up again, his name instead of the practice. But based on that, I would assume that he is in network. Now let's try searching my doctor and see if he comes up as in network. So we have to change the way that we have his name formatted. See, there's no drop down here, so that's a little concerning to me. So he's coming up as not in network. But interestingly enough, I know for a fact that he is in network because when he treats me, it gets billed as in network and the practice is listed as in network. So as I said before, this network search, it's finicky. They all are. So what I would recommend doing is searching the network, finding a doctor's or provider's office, using the Google results that you want to go to, checking to see if they're in network. Sometimes only one of their providers will come up as in network when all of them are, like with my primary care provider. Sometimes they'll all show up in the network search. It kind of just depends. If one of them shows up in the network search, like Michael Hardy obviously owns the practice, he showed up, that's a pretty good sign. It also shows on their website that the First Health Network is an accepted insurance. So the savvy healthcare consumer would assume based on this information that they are probably an in-network provider. And when they called to book the appointment, they would ask to verify that all of the NPs and doctors will be billed as in-network. So that's what I would recommend doing in this situation. If you want to go to a provider who is not a member of the PPO network, remember, you can do this. You do not have to stay within the network. If there's a doctor who has great reviews that you want to use, go forth and use them. You do not have to use a PPO network. It's just if you go out of network, you will have to self-pay and file your own claims. The benefits remain the same. You just have to front the money. If you go to an in-network doctor, from my experience and my client's experience, you will just give them your insurance card and they will file the claim with Philadelphia American on your behalf. So it saves you a step. The other advantageous thing about using the First Health Network is that they offer a PPO network discount. So they have discounts negotiated between the insurance company and the doctors and providers. and they don't tell you what the discounts are. There's secret discounts, but they are pretty significant. PPO network discounts tend to range from like 30 to 40% off of the sticker price for healthcare services. So my experience of using the network discount has been really beneficial. And I don't like to file claims, so this is how I typically do things. I hope that that helps. If you have additional questions on utilizing the network search for this fixed benefit plan or for any other insurance products that I have helped you with purchasing, please feel free to give me a call. I'm always happier to do an individual training in greater depth. I hope you guys have a wonderful day. And again, I hope this was useful. Take care.